My Pet's Wellness closes all clinics overnight.
Couldn't even say one more day to tell everybody?
They can't service their debt with the amount of money that the clinics are making. So what they do is file bankruptcy.
I hope a lot of the other clinics are accepting these new clients and patients, because we always still run into the fact that clinics are too busy. Go call All-Star, go somewhere else, blah, blah, blah. We don't have time for you, for their own patients and clients, let alone new patients and new clients. So I'm just like, people better open up their arms and open up their doors.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Somebody get the hammer.
Yep. Bada boom, bada bang.
You guys, that was like pretty that was like
we are the same person.
It's pretty impressive. Okay.
Go ahead.
Where are you at? Go for it. Who's talking?
I'll do
Reviews?
it. I like doing this.
All right,
Yeah.
do it.
Okay, so don't forget to write us a review on Spotify and Apple Podcast to help, because it helps boost our algorithm, supposedly. Okay, so last time we were at 330 on Spotify, but now we're at 331. That one person, thank you, God bless. And then on Apple Podcasts, we were at 129, and now we're at 130.
Whoa, slow down.
I know.
Wow.
We're getting up there.
One review in a
remember
week.
the tortoise and the hare?
That's right.
Who wins?
And do you
The
remember
tortoise.
when we started? It was like 0.
Hey, at least we're making progress. I mean, it's still going up by 1. It doesn't matter.
It
It's
was
still
2.
one
One of them was
person.
my mom.
That's
Just
right.
kidding.
That's right. It was your mom. Absolutely.
I'll take it. We moved. That's all that matters.
Mm-hmm.
Thank you for your reviews, you two people out there.
Watch us, because we're kind of funny sometimes, on Instagram and TikTok at the I said TikTok at the Veterinary Roundtable. And we have our own little YouTube channel now. It's where all of our podcasts and videos are. It's the Veterinary Roundtable on YouTube.
If you want to watch and not listen.
That's right.
That's right. I'm Dr. Emily King.
You missed it.
I missed it. See, I put the arrow there and I didn't even remember it.
Right. Okay, back up. We have some big news.
That's what I said. Put it on your sheet too. Okay.
Big news. So make sure you listen. Just if you don't listen to anything, listen to this. Okay?
Turn up the volume in the car.
Okay, take it away, King.
Okay, we're changing the day of the podcast release.
We
Yes.
are.
Duckwall, what are we doing?
changing it
It's
to?
going from Friday mornings to a Tuesday morning.
Mhm.
So now you can listen to us at the start of your week, on the way
Yes.
to your work, your school,
Mhm.
on the way home, getting ready for hump day, when Tuesdays are kind of a hard day in the middle
Yeah.
of the week.
Yep.
You know,
I
you're
don't
like,
like
"Ah,
Tuesdays."
it's only Tuesday.
Yeah.
So now you can listen to us.
Now you can
Yeah,
listen.
so you can start the week instead of end the week. Or if you really prefer, you can just wait till Friday and listen to it.
Exactly.
If you really enjoy Fridays,
In your
just
head,
wait.
it can still be released on
That's right.
Fridays. That's
Yes,
right.
But
That's
9
right.
a.m. Eastern Standard Time on Tuesdays now.
That's correct.
No longer Fridays.
That's
but
because
still
we
on
are
all the
changing
same.
when we tape. So
Yes.
we
That's
just
right.
have to
Adjust
adjust.
so
yeah.
that we have time for the editing.
Well, Harrison has time
Yes.
for the editing, not
Exactly.
us.
If there's any reason you're really against it, let us know. Leave us a
Yeah.
review.
That's right. Give us your thoughts.
Okay, now we can do it.
I'm still Dr. Emily King.
I'm Courtney Allen.
I'm Dr. Ashlyn Duckwall.
Okay.
You were
and-
listening to the Veterinary Roundtable.
Amen. Hey,
Welcome.
listen, I do want to give a shout out to Henry Dobson, who's our producer tonight.
Yes.
That's right. We have
So,
a new producer.
Harrison has
nephew-
left the building.
I know Harrison has left the building. So everyone, you can blame Henry. No, I'm just kidding. No, Henry is 15 and he's more than capable of running the podcast.
Heck
That
yeah, he
means
is.
all bets are off.
And
We
he
can do
came in
whatever
at
we
the
want.
last minute, man.
Dad's gone.
He like bailed us out the last
Oh,
minute.
really?
Yes, because
Oh,
Harrison
wow.
told me the last minute when I was driving home from Tennessee today that, hey, can Dad do the podcast? And I was like, Calvin has track. Like,
yeah.
he missed track last time because you needed Dad to do the podcast.
Yeah.
And then Dad said, you know what? I bet Henry would be a great person to do the podcast.
Harrison.
So then I was feverishly texting my sister going, is there any way Henry would be interested in doing the podcast?
Family
Bad
always comes
Harrison.
through.
Henry, out of curiosity, were you obligated to do the podcast or did you want to do the podcast? Okay.
Well, we
Oh.
appreciate you being here
Okay.
with us.
Yeah,
Yes.
thanks,
It's a good time, I
Henry.
promise. We're
Yep,
kind of
thank
funny.
you.
We try to be.
All right. So pits and peaks.
Oh, shoot. I didn't even think about it.
I got mine.
Okay,
go
go
ahead.
for it.
Okay. My pit is that I'm not feeling great. I don't know, my throat got scratchy on Friday and then it just went downhill from there. But I'm not feeling as bad as I thought I would. I've got congestion, but We're chugging along. So
You're getting there.
there's a bright side to the pit there.
Okay.
The peak is our date we did on Saturday.
Ooh, follow up.
Yes. Okay. So this was my peak last week because we were finally going on a date. So we ended up deciding, okay, first I found out Charles wanted to do glass blowing. He said I was going to get us an appointment, but they didn't call him back. So then we were trying to think of this whole list of like an activity. We ended up on throwing pottery or throwing clay. So we made a bowl.
Oh, that's so cool.
We went to a class and learned how. It's honestly very therapeutic, but my personality is very type A. So I was like, I need to get this right. And so when I messed it up, I was like, ugh. Because in pottery, if you get to a certain point, you just got to start over.
Yeah.
You mess up the bowl.
Yeah.
So the first bowl I made was more like a salsa bowl. It was kind of tall and very shallow. But the second one I made was more of like a cereal bowl where it had a little bit more rounded edge. I figured out the movement and stuff.
That's
you gotta
so cool.
place your hands just right.
What?
You gotta place your hands just right to make like
I
something
know.
you can use.
And then it has to be kind of even as the thing spins. And
if you move your hand one little wrong, you go.
Yeah. It was great.
Done.
We were with another family in the class and it was just super fun. And then we had time to kill because we made dinner reservations. So we were walking around and there was this like old history museum in this house downtown Noblesville. And he's like, you want to go in it? I was like, fine. Super cool.
Yeah.
There's this old jail in the back of the house. Time to kill. It was great. I love like old houses, but old jails is like super cool.
Yes.
So we did that.
That house has been
That's
there forever.
cool.
And then we went to dinner. Yeah.
Where'd you go to dinner?
Went to the Courthouse Club.
Oh yeah, I've been wanting to go there.
It's so good.
Was it good? Because I liked
Yes.
when you look at it from the outside, the ambience on the inside looks really cool.
It is. It's really like chill, and I mean the food was delicious. We got
good to know.
appetizer, main course, dessert. It was great.
Yeah, I think it's been open for like 2 or 3 months now. It is phenomenal.
Yeah.
Okay, good
Highly
to know.
recommend.
Yes, my parents are
Shout
obsessed with it.
Okay.
Mhm. Yeah.
I'll have to visit.
I got the sushi, cooked shrimp sushi. So good.
Okay.
Just FYI.
Is everything okay?
Oh yeah, that was from when I was watching the babies. I had to download the thing I was telling you guys about. That was the Owlet Dream Sock app.
Yeah.
And it's telling me there's a notification that the babies are it's not connecting to the base or something.
Alert! Your babies are not there.
Anyway, sorry about that.
That's all I have.
Expect a second one in another minute or so because there's 2 socks because there's 2 babies.
Sure. Okay. Got it.
So,
Don't be alarmed.
You want to go? You want me to go?
Sure, I can go. My peak was that I had a really good weekend. I feel like this has been my peak like 17,000 times, but I got to spend time with my family. So my birthday was 2 weeks ago now. My mom and I's birthday are 6 days apart. So this past weekend we celebrated her. We walked around downtown Noblesville. I don't know how we did not see each other because we were in the same place at the same exact time. Yeah. But we walked around. We went to all the little shops, which I love, like all the little antique malls and everything. That was really, really fun. So it was just good times and it was nice weather and
Very cool.
It was good. My pit is I have a lot of stressors in my life right now, which is never good. One of the big ones being my car. So I have to get a new car.
Oh no!
And new cars are really expensive.
Wait, I thought you got it fixed.
So, well, we did something they thought that it would fix it, but it wasn't a guarantee. I have a 2013 car with 240,000 miles on it. It's a Honda, so I mean, they're great cars. They last forever. But this year of car is known for having transmission issues. So I called Honda today, and he was like, I mean, the next step is to put a new transmission in it to fix the issue. But the car is not worth dumping $7,000 into. So my car has he's like, it could give out in a year. It could break down in 6 months. Like, we don't know.
Yeah.
So that just really sucks. I also really, really love my car, and I was expecting it to last me a little bit longer.
Yeah.
So
It's
that's
been
just
like a year or two, right?
I've had it for 2 years. I mean, I bought it with over 200,000 miles on it.
Right.
But like I said, it's a Honda. They last forever.
Right.
But yeah, so we'll see. It's just a lot of stress
Well, yeah, that's a big
when you're not
commitment.
expecting it.
Yes.
So, and then my husband's like, we can just get another used car for now. I'm like, I'm not going to get necessarily a brand new car, but I'm not going to get a used car like this one because then we might just run into more issues and it's just more money. So it's worth just getting a nicer car right now and spending money on that rather than like fixing a car over and over again. So we'll see.
Yeah.
I don't know. My car could break down at any minute, pretty much.
And the market changes all the time for like used cars, and I don't even know where it's at anymore.
Yeah.
Yep.
So we'll see.
Yeah.
Just stressful.
Yeah.
Lots to deal with.
My pit is more like from a realization of how difficult it is to get into veterinary school. Like, because I had this person DM me that was struggling getting into veterinary school for like years and years and years. And then they found out that they got in. And so that's my peak, is that they got into veterinary school after trying for so long. But I'm like, why is it so hard if somebody has tried 3 times or 4? Like, what?
Right.
Like, shouldn't there be like, I don't know, some like, okay, you've applied the 4th time, we're taking you because clearly you're interested in this profession.
Right. You're obviously committed.
Right.
Yeah.
I mean, I was just thinking like, I don't know if I would ever wait or try that long. That's a long time.
It's a long time.
Just start over.
Yes.
At that point.
Right.
And I'm like,
well, it's
there
also,
just seems to be something wrong with whatever.
It also probably chips away at you each time you don't get accepted too.
Yeah.
And then it will probably discourage you from wanting to be in the field maybe.
But I mean, good for this
suck.
person.
But
because
yes,
clearly,
she got in.
yeah.
She is clearly a good asset
And
to the vet med
you know
community.
what? It took long enough, but you know what? She persevered and stayed with it.
Good.
And so
That's great.
it's pretty awesome. So that's my peak.
Smooth sailing from here.
Yeah.
That's right.
You got it, girl.
All the hard work's over.
Yeah.
Right.
That's some fun.
That's right.
Oh, gosh.
Oh, gosh.
Okay,
Oh,
Tales
dear.
from the Trenches.
Okay, so if you haven't heard already, we have a new segment called Tales from the Trenches. This is where we want our listeners to send in their most ridiculous, funny, unhinged stories that we can then read on the podcast. You can send these stories to theveterinaryyroundtable@gmail.com. Without further ado, here's our Tale from the Trench for this week.
Okay.
Okay. Dear Veterinary Roundtable, my name is, I'm sorry if I butcher this, Pelham? That's what I'm going to say it. Okay. Steffens or Stevens. I am a senior wildlife pre-vet student at Auburn University, and I'm applying to vet school next round. I listen to your podcast every week, and I love your new segment, Tales from the Trenches. A few weeks ago, I heard the story of the woman who took her pants off during a euthanasia so that her dog could have a pair of her underwear, and it reminded me of a strange case I had a few years ago. Oh, dear. A few years ago, I was working at a clinic, and a guinea pig was being presented with diarrhea, fatigue, and not eating. When I went into the room to collect the patient's history, in the room was a mother and her 12-year-old daughter. Once I spoke with them, I found out that the guinea pig had fallen off the bed 2 months prior and was paralyzed from the quote-unquote waist down and had no use of his back legs. When I took the patient back for examination, the doctor and I discovered that he had completely eaten the skin and muscle off of his back legs down to the bone.
Oh, no.
It, to this day, is one of the craziest and most foul-smelling things I have experienced. The doctor, of course, said the only course of action was humane euthanasia. The daughter then threw a full tantrum, and the mother continued to ask both me and the doctor about attempting a 3rd course of antibiotics. The doctor said that the antibiotics would not help, especially since they had tried them twice before and the patient's condition had only worsened. The doctor and I left the room and gave them a few more minutes with their pet. I then went back in to see if they were ready after about 15 minutes, and upon re-entering the room, the mother asked the girl to say goodbye to the guinea pig and hand him over. Instead of doing this, the girl begins to bite her mother's arm, and not just a little bite, I mean full-on draw blood type of biting.
Oh, no.
While this is happening, the mother continues to look at me and ask me questions while her daughter is chewing on her arm and screaming. This is one of the strangest things that has ever happened to me, and it was not the first time that when the daughter did not get what she wanted, she had acted out in the clinic. She had also yelled at a doctor when they recommended euthanasia for the first time.
Oh, no.
Those are such hard times in an
that is
exam
a
room.
very difficult situation to be in because, I mean, I'm not a parent, but as a parent, like having to deal with that on top of losing a pet and like, I mean, how do you even, how do you handle that?
I don't know.
And then like as staff, I would just stand there.
Yeah, those are really hard because
Yeah.
the parents navigating is basically trying to navigate both sides of the fence.
Yes.
Right.
So it becomes really difficult.
And it's definitely not your place to stand in that.
No,
Right.
that's what I'm
Dip your
saying. You
toes
just
in
like,
that, so...
I would just continue going with like the patient stuff and just kind of ignore what was happening because it's not your place.
Right.
That poor guinea pig. I mean, we've definitely seen animals chew or bite on things that probably nerve pain or whatever.
Self-inflicted injury.
Yeah. But can you imagine like the smell?
The whole half of your body. I'm sorry.
We always laugh at these because it's just like, what else? Like, how could you?
It's what you envision.
Well,
Like,
how could you
like, could you imagine a person?
Here's my guinea pig.
No,
It's
not
degloved
the
from the waist
person
down.
being.
Oh,
Someone just like chewing on their ankles.
Oh gosh,
that poor guinea pig.
I know.
I just
Oh.
sometimes
Can you imagine what their house smells like?
Well, how do you let that?
It's like the client with a really bad ear infection, and you go in the room and you think you're gonna vomit.
Yeah.
Because it smells so bad. And you're like, have you ever been shut in a room with your own animal? Here, let me take you outside for just a second, and then you re-enter the room.
Yeah.
And then tell me you don't want to treat your dog.
Yeah.
Because that will convince you to treat your dog.
Because
Yeah.
they get immune to the smell probably at some point, but woof.
Oh my
Yeah.
goodness gracious. Yeah. Ugh.
I feel bad for the mom. Like my heart goes out to
gosh,
her.
yes.
Like,
Yeah.
Well, because clearly the child has like an issue with, like
Right.
whatever. You know what I
Coping
mean?
or
Like, so,
whatnot.
yes, yeah.
And so, yeah,
That's a tough
How,
situation
so
to be in.
how do we don't know how it ended?
surely the
I'm
pet
gonna
was
assume they
euthanized.
euthanized it. I'm going with that.
I would hope so.
I really hope
Yeah.
they
I
didn't
really
take
hope
that guinea
so.
pig.
I mean,
home.
you can only do so much. Like people will go against medical advice.
Yeah.
So,
Yeah.
oh,
I'm gonna hope that's what happened. I'm gonna
Oh,
tell myself
goodness.
that's what happened.
wow. Thanks for sharing.
Yeah,
That
thanks for
is
sharing.
a grotesque image.
It
On
is.
all
I don't know if I
accounts.
can get that out of my head.
On all accounts.
Good luck with applying to vet school. That was at the
Yes,
beginning.
good luck.
Yes, good luck. Hey, listen to our future episode. We're having a person from
Yes.
LMU admissions on to talk about admissions into veterinary schools.
We
So
are.
Keep listening.
Make sure you check it
Sounds
out.
like you're an
Yes.
avid listener, so keep listening.
Keep listening.
Yes.
Okay.
All right. Next thing, trending topics. First one we have is
Yes.
My Pet's Wellness closes all clinics overnight. Wow.
This was
Yeah.
really like, woo!
I would like to be a fly on the wall.
My
Right?
instant thought was, how would anyone get records to know?
That was literally my first
My
thought.
first
as I
thought was the
reading.
records because
Yeah.
owners,
So
you
many
know, don't
things.
have them.
Well, when you go to their website, like My Pet's Wellness website, it says call this number if you need your pet's
Oh,
records.
so they still are doing that.
Okay.
Well,
Well,
I
problem
mean-
solved.
Well, I have no idea. I mean, they probably have, right, because it's a chain.
Mhm.
So they probably have
I would
a
hope so.
server that has all the records.
Right.
And so that's why it's going to that. You're
I
calling
mean, I
that
would
number
hope
to
so
get the
that they
records.
don't just like ghost all of their clients.
Yeah. Well, I mean, you do to some degree.
But
I
yeah,
I mean,
you're
they
ghosting
did.
them.
They said sorry.
that's
peace
true.
out.
Yeah.
I just can't imagine, like they said in the article, a huge financial, what did they say, issue? I don't know what
Yeah.
word they used. And it's like, you couldn't even say one more day to tell everybody? Like, you're just like,
I think
It must have
that-
been like pretty serious if
Well, I
they just
think
had to like
I was asking Richie about this, and I was like, okay, what do you think? with-
hypothetically what happened.
Yeah, like hypothetically
Yeah.
what happened. And he's like, okay, well, My Pet's Wellness is backed by a private equity firm called Cold Bore Capital. And so they basically bought, or they subsidized, financially supported
yeah.
this company, Pet Wellness, My Pet Wellness. I can't even say that.
Yeah, because
right.
it's My Pet
So-
Wellness. There's also
My Pet's Wellness,
yes,
right?
My Pet's
Clinics.
Okay.
And so what they did was they overpaid. So if you go back and you look at like some of the historical transactions, like I think this all occurred, they invested in 2021, which was COVID, when everything was hot. They overpaid,
Ew.
so they can't service
Oh.
the debt. So then my
Mm.
question to Richie was, okay, well, the clinics are clearly, the clinics are
Right.
making money. They're paying their bills. Why can't they just stay open?
Right.
And he said, well, because they can't service their debt with the amount of money that the clinics are making.
Hmm.
So what they do is file bankruptcy.
Mm.
Oh.
And so
That makes
they
sense.
can't, so they can't service the debt. And he's like, usually they just, he's like, this happens all over the place. It happened with, he was giving me examples, like Marsh supermarkets.
Yeah.
Somebody pulls the assets out of it, the cash out of it, and they
Right.
bankrupt it or whatever. But anyway, so I have no idea if this is
Right.
true. This is
Just
just
spreading rumors.
pure speculation.
Stirring the pot.
Well, I mean, it's only been 2 days since the
Right.
story came out. So by the
We
time
will find out. I'm
this
sure.
podcast comes out, maybe there'll be
Yeah.
more information. But
That's crazy that they closed
I don't know.
multiple locations. They closed all
all
of
of
them,
them.
All of them.
which is
overnight.
insane. Yeah,
Overnight.
I know.
The thing that really, and this is one of the reasons why I will never support wellness plans, is because those people who paid into those wellness plans They're stuck.
No
Yeah.
more money. You don't get your money back.
Nope.
Nope.
No refund for you.
So
It's like, don't they sign it for like a whole year
A
wellness
year.
plan
Yes.
too? So
Mhm.
if you're not happy with the service, we've had people come
oh yes,
who are not happy with the service they paid for.
And they're
like,
stuck.
well, yep, I lost money because
yeah.
whatever, XYZ. The other thing I thought instantly reading that, I was like, well, I hope a lot of the other clinics are accepting these new clients and patients, because we always still run into the fact that clinics are too busy. Go call All-Star, go somewhere else, blah, blah, blah. We don't have time for you, for their own patients. And clients,
Mhm.
let alone new patients and new clients. So I'm just like, people better open up their arms and open up their doors.
Yep.
If not, come to All-Star.
Well, they're not located
I
near
know.
us.
If you're in Indiana, come to All-Star.
So it's very interesting. I tried to figure out how many. I could not find it anywhere. I didn't have a ton of time to look, but how many clinics there were total.
Yeah, I didn't
But there were several in Texas, several in Tennessee. I think their corporation was housed in Tennessee, and then South Carolina
Have
and
you
Florida.
been there?
Have you what?
Have you been there?
No, I know.
I wasn't even familiar with them.
No, me neither. So I don't think it's like a gazillion of them. Like 300 or 400. I think it's like
A
10,
handful. Yeah.
something like that.
Hmm.
Anyway, interesting story. We'll
Very
report back
interesting.
once we know more.
Yes. Okay, the next one is interesting. New immunotherapy treatment may delay metastasis in dogs with osteosarcoma. So basically, it's this new drug that they've been working on the human side as well in the breast cancer realm, because it focuses on the HER2. Was it HER2 like gene, I guess,
Yeah.
that gets turned on and off and all of that. So my understanding was that it's going to slow down, obviously, the metastasis to the lungs, which is where it goes. And most commonly when you find osteosarc, even if you don't see it on the dog's lungs, it's probably already microscopically there. So my understanding is you can use it in combination with doing like an amputation or chemo, or I thought I understood you can use it alone as well without doing anything else.
Yeah.
So it's not out yet, but
I think they're hoping, right, for it to be limb sparing.
Yes,
yeah,
I mean,
that's what I
avoid
thought.
I mean, yeah,
amputation.
right, like to avoid amputation.
yeah.
And so
or radiation. Sorry,
Right, radiation
use it in combo
and
with
this
radiation.
drug. Yeah.
Yes, not chemo, but
And because I think isn't the mechanism or whatever the word is between canine and human osteosarcoma
96% or
Yes.
93% similar or something
Yeah.
crazy. So,
So then whatever's going to work in a dog is
Mhm.
probably going to work in people.
right,
It's very
which is
interesting.
fascinating.
That's so
Yeah.
interesting.
I feel like there's crossover of diseases, but I don't know if it's ever that high of a percentage to have it match like that, or if there is, I just don't know. But
it's really cool though,
yeah,
especially with that big of a cancer. That's
Right.
pretty awesome.
that's fascinating.
So very cool. It'll be interesting to see what.
Yeah, because osteosarcoma
know.
sucks.
Yeah, I was just thinking too of like, the couple like oncologist clients we have and stuff, and human, yeah, and just like I would be so intrigued to have a conversation of like,
What do you guys think?
yeah, what do you
Yeah.
guys do? What do
Yeah.
you think of this?
Mhm.
And
Yeah.
I don't know, it's fascinating. Okay,
It's not going to be out for a while, though, is it?
Right.
2
No.
years? Does it say?
I think it said I think you're right,
2027 or 28 or something?
Yeah, it's.
Yeah.
I mean, I don't know. It's still going through trials and all
Stuff.
that. Long
Still going
stuff.
through stuff.
Mm-hmm.
Okay, case collections. I'll do mine. It's pretty fast and straightforward, but it's interesting. So it was probably several weeks ago now, a month ago now. I just did a neuter for. It was a Bernedoodle, mini Bernedoodle, and he was, I think, about 7 or 8 months at this point. And after the neuter, I always look in the mouth just to make sure there's no retained deciduous teeth if I forgot to do it before anesthesia or what have you. So looked in the mouth. One side looked great. And then on I think it was his right side, I don't remember, one of the upper premolars looked very bizarre. Like there was a very small percentage, maybe, I don't know, maybe like 15 to 20% was actually out of the gum, and the rest of it was like covered by the gingiva. But even the shape of what was poking out didn't make sense. Like I looked at it, I was like, I don't think this is a retained deciduous, but it also doesn't look like a normal adult that came through. So then you start wondering, like, was there trauma that happened when it needed to come through? Whatever. So Dr. Cloud, who does a lot of our dentistry, was on dentistry that day, and she took a peek at it and she goes, oh, wow, I've never seen a tooth like this before. This is very bizarre. So he was still under anesthesia. He was doing great.
Mhm.
So I called the owner and I explained and sent her pictures when we were on the phone. I was like, do you see the difference of this normal upper premolar and then this one that's weird? And she was like, oh my gosh, yeah, that's very different. And I was like, well, I mean, we recommend he's under anesthesia now. Let's take an x-ray of the area. And if needed, we extract the tooth. The other tooth we were worried about was the one right behind it as well being affected. So we ended up taking the x-ray, and the x-ray showed that because it has 3 roots, it was sideways, completely sideways.
It was a crazy x-ray.
And then when she did the flap for the gingiva, again, it was completely sideways.
Mhm.
So instead of being down, pointing down out of the gums, you literally take your fingers and point it horizontally. It was the weirdest, bizarre thing.
Mhm.
And so, yeah, she was able to remove them. She's like, once you started removing the bone and separating and whatever, she's like, it was a pretty straightforward extraction for her, of course.
Right. I was going to say.
I'm glad I wasn't doing it.
Like, why aren't they going this way?
She's like, are you sure you don't want to do it? I'm like, I'm good.
I'm positive.
You do it. The tooth behind it wasn't messed up enough to have to remove it or anything like that. But yeah, I have a picture of what it looks like before the extraction and then when we opened up the flap so you can visualize.
Oh, yeah. You got to send that to us so we can post those.
It was very weird. It was very bizarre. And she'd been doing dentistry forever. And she's like, I've never seen that. I don't know what it is. I'm like, okay.
That's awesome.
Yeah.
Interesting stuff.
Yeah, it was weird.
Always check them out.
Yeah, always check them out.
My case is a 8-year-old male neutered Labrador, like a labradoodle.
Probably
A doodle.
Probably a doodle.
Doodle. No, he was a doodle, but I'm trying to think. I don't think he's a golden doodle. I think he's a labradoodle. He came in because he had just not been acting like himself, and the owner thought on his walks he was more tired than usual. And I haven't talked about this case, right?
No.
Okay.
Not that I know.
And he was drinking a little bit more water and wasn't eating as well as he normally would. So we did complete physical exam on him. He was bright and alert in the exam room, but he had dropped 10 pounds from the last time that she had brought him in. And it wasn't like it was that long ago. It might have been 6 months ago that she had brought him into the clinic. And let's see what else. On his physical exam, it was fairly unremarkable. Everything pretty much checked out boring. Like there wasn't anything that really was like, oh, okay, this is this body system that we're going to chase. So we ended up running just labs on him. So we just did a urinalysis and then CBC and the chem lights. And his labs came back as he had an eosinophilia. He had a hypercalcemia of greater than 16. He had a mild azotemia. Like I think his creatinine was like 2.789, somewhere in there. It wasn't high. His BUN was like 60 something. His phosphorus was mildly elevated. It wasn't like, and when I say elevated, I mean, when I see azotemia, I'm wanting to see the phosphorus like at 4.
Mm-hmm.
So it was higher than 4. He was not hyperkalemic. He had a normal white blood cell count. He was lymphopenic mildly. And so once we got those preliminary labs back, then we added on an Acuplex to rule out tick-borne disease, a couple of tick-borne disease like Lyme disease. His urinalysis was pretty boring. I forgot to mention that. He didn't have any protein loss in his urine. His urine-specific gravity was normal. So we got back to Acuplex. It was negative. So then we started working through differentials for hypercalcemia and azotemia. And I think it's just such an interesting case because the reason why I want to talk about it is if you work things up in a logical fashion, typically you most of the time will get to the end result.
Yeah.
And it's not that you have to do everything all at once. You just need to make yourself work through them logically. So after we did the Acuplex, then we talked about hypercalcemia malignancy panel that we sent to Michigan State University. And then based on those results, then taking chest films and abdominal films. And then also we added on a baseline cortisol because he's a poodle mix. So just to be thorough.
Yep.
And so we worked our way through that. I do not know because Dr. Limpert got back the hypercalcemia malignancy panel. I don't know if his PTA-RHP if that was high or not. So it could have been, but we ended up taking his chest films. We also checked his anal glands. And he had a big mass in his chest.
Oh.
Yeah.
Darn it.
Bummer.
So found the answer, but just not a good one.
Right. Yeah. Yeah. High calcium, high High
High calcium.
Hypercalcemia.
Hypercalcemia,
Okay.
yes.
Yes. Yeah, that's always the one where I look at, I'm like, ugh.
Right.
Because it's straightforward in the process, but it's still a lot of steps through the process if you don't find it right away, like
Yes.
an anal gland.
Yes.
So then you have to you have to prep the owner, like all these things have value to why we're looking, but it's not always straightforward right away.
Yeah, you don't always find the answer until you get to
Right.
step number.
And some people
know.
think, you do one blood test and there's your answer and you have whatever.
Right.
But
Yeah.
that's a good case, but that's a
And he
bummer.
was a super nice dog, of course.
Yeah.
So I don't know what they're doing in the meantime. I don't know if they started him on pred or did, something else to make him more comfortable.
The last primary lung tumor I had, the oncologist recommended actually an NSAID because it's probably more likely a carcinoma.
Okay.
So I don't know. I don't know what they're doing.
Yeah.
So
That's interesting.
Darn.
Okay.
Oh, darn. Okay, on to the listener inquiries. Take it away.
All right. To continue using our text message feature for our podcast, all you'll do is tap on the episode in your podcast provider of choice. You look at the top where it says send us an inquiry through a text here. You click that link and you send us a text. And if you would like a shout out on the podcast, you do have to include your name. Otherwise, it comes through as anonymous. All right. First one. Hey, VRT. I love the podcast and look forward to new episodes every Friday.
Okay,
Oop,
hopefully.
it's changing to Tuesdays. But once again, you can wait till Friday. I was just listening to the most recent episode regarding the intranasal Bordetella. We use this at my clinic. Absolutely love it. From my understanding, it is more effective due to it targeting the mucous membranes more. We have a sub-Q Bordetella as well in case we are unable to deliver the intranasal one. In my experience, it is wonderful, but I would love to know your thoughts if you guys start using it. Love you all. I'm a huge fan. Molly.
Thanks, Molly.
Okay.
Has she convinced you?
Nope. I've already used it. I know I don't like it.
Even the smaller volume. You don't think one nostril?
I mean, sure, I'll try it, but I even thought about that today because we started talking about it at the clinic. I don't know how Devin was talking about it.
Huh.
I don't know how it got brought up. We have injectable at the clinic too, by the way, for patients we can't get near their face. But I was giving a Bordetella to a doodle who was spastic. Like, I mean, she was just panicking. Like, I came anywhere near her and she was just bolting from me. And I got it to where she was sitting still for a brief second. She was panting. Like, the intranasal has to be so much more accurate and like on a moving target because we don't want to, I mean, injectable Bordetella isn't going to harm them by any means, but if you can avoid another poke, you probably want to. And so like,
well, it's better in the mucous membranes too.
Right. And so like, it's just with the the oral, you have such a bigger target.
Yeah.
And like those panting dogs, like especially the aggressive ones, like how am I supposed to be like, okay, where's your nasal? Like, how do I shoot it in their nose that accurately?
We'll have to ask Sarah Pate if the local immunity is better with the new product.
Right.
If that's the reason why
Yeah.
they went back to it or are recommending it, and then why they also decreased the volume. So maybe to increase compliance, like
Right.
on our part, like us wanting to use it.
Right.
I don't know.
I
That'll be interesting.
I just remember the old one and how excited I was for oral. It's still not a great vaccine because, I mean, you're still having to get near your dog's face. No
Yeah.
dog wants something shot in their mouth.
Yeah.
But I remember not liking it. But I can report back if we do get the nasal one. I'm going to make a petition. But if we get it, I'll let you know.
I mean, I think it makes more sense that it's probably more effective in the nasal mucosa. You're talking about respiratory diseases.
I would agree.
Right.
So I get it. Not saying I get what you're saying too. The bigger target, and I've watched you like have to.
I mean, you see how
go
fast
from
I
the
can
side.
shoot pretty hard,
Right.
but like it's going in the mouth, so you have a
Wider
larger
target. Yeah.
space.
All right. Well, we'll keep coming back to it, I guess, because we don't. No news right now.
Yeah.
No news yet.
Okay, number 2. Hello, Vert. Obviously, you guys are at sea level, but wondering if you've had any experience at treating patients at a higher elevation. We are moving to the mountains and curious how elevation impacts veterinary treatments and medications. Anonymous.
So
No
interesting.
comment.
I read this. I
Yeah.
read this question, then I had to go look it up because we
Yeah.
Oh,
don't
yeah.
treat animals with altitude sickness.
I remember kind of learning about it in school, but
Yeah.
I
so it is
didn't
a
even
thing.
learn about
yeah.
It's actually a thing. They similar things happen to them that happen to people with altitude sickness. And
So what, their blood and like respiratory,
Yep.
isn't it something
so
like
like pulmonary edema,
that? Okay.
like I think that's like bad. Like
Yeah.
and then respiratory, so that's respiratory. People have like brain stuff. Like I think you can have cerebral edema.
it. Oh,
Okay.
dear.
And then you can have just minor symptoms. Like the dog can just have increased respiratory rate, agitation, nervousness,
Sure.
like, because their oxygen saturations go down.
Right.
So apparently like 8,200 feet is like where you're going to have a problem.
Oh.
And their oxygen saturation, if you take somebody that brings normal room air oxygen, it drops to like 84 or something like that. So like they're extrapolating to pets.
Right.
So a normal dog would go from 93 or whatever to 84 or 83.
Wow.
It's not a problem unless you have heart disease.
Oh, yeah. That'll get you.
Or pulmonary hypertension, because now you have a dog whose oxygen saturation isn't at that high normally, and so it then even goes lower. And so then those dogs really struggle.
That's a recipe for
disaster. So they said, and I don't know, did you happen to look up any?
No.
They said that you could do the things like you talk about in people. Like, so if you're going to someplace that's 8,200 or above, then you stop halfway and you stay there for a couple of days.
That makes sense.
And let them equilibrate.
Acclimate.
And then,
Probably
move
don't
up.
go running or long miles walks when you get there either.
Yep.
Slowly acclimate.
Exactly. Yep, that was the other thing. And then, or like if you have a dog with heart disease or
Don't
pulmonary
go.
hypertension, yeah.
I mean,
that's a big decision.
And pulmonary
to think about.
hypertension is not easy to diagnose because you have to go to a cardiologist, and I feel like a lot of people don't want to go if their heart seems fine.
Yeah.
Ooh.
So it's very, it's
Don't
very
go to the
interesting.
mountain.
I know. I was really, like interested once I started looking up the question, because I was like, oh, wow, okay, this really is a thing. And then I was wondering about the medication.
Oh.
And they talk about that in airline pilots, like with blood pressure meds, because they have a lot of issues because they go up and down like, over and over and over again.
I never think about that.
Yeah, like cardiac disease and pulmonary. Anyway, so they're screened all the time because of these issues. But medications, there are certain medications, I guess, that can be affected by altitude. But the stuff that I think we most often use is not.
Doesn't matter.
Yeah.
Fascinating.
So all
interesting.
pilots have their own personal cardiologist. Is what you're saying.
If not, maybe recommend it.
So it's really cool, really interesting.
That
But
is-
yeah,
I
be
never
careful.
think about
Don't
that.
just go from 0 to
0 to 100.
yeah.
Woof. That'd be hard on you too.
And
the
I would
person.
I'd probably call somebody, like if you know what area you're going to be living, call a veterinarian in that area, and say, hey, I'm moving to this area.
That's a good suggestion.
What do you recommend?
Right.
Like as a way of getting us acclimated to the.
There's no way they haven't
Just
seen
be
anything
prepared.
like that
Oh gosh,
before.
no, yeah.
Especially if you're living there.
Yeah.
Huh. That is so interesting to think about. Thank you for the question.
Yeah.
Yeah, very good question.
Do you want to read it?
Okay, sure.
Okay.
Howdy, this is Katie, and I'm a second-year student at Texas A&M. I have asked many questions, and thank you all for the amazing answers y'all have given me. Y'all may remember my Instagram handle, Katie the Future Cattle Vet, from all of my inquiries. I did want to ask y'all, how do you balance treating patients while still keeping in mind antimicrobial resistance? I feel like we learn all of these different antibiotics, but then we're told basically not to use them. Oh, see, second outlet. Thanks for all that y'all do, and hope it's not as hot in Indiana as it is down here. Katie.
Well, Katie, I can assure you the weather here sucks.
It is not hot.
It's
We're not in
definitely
jeopardy of
not.
it being hot.
We have not
So-
sweat yet.
Oh, this is a topic I'm passionate about, because once I started reading about it, I was like, oh, we need to be doing stuff differently.
I know.
And then I passed that on to you guys, and you guys are all like, not listening, not looking,
More work.
Yeah, it's hard.
It is hard.
It is interesting that you learn all that, and then they're like,
Yeah.
but don't you use it?
I know. How do you deal with it? So you obviously, like Dr. King is alluding to, you read the newest studies or thought, like a consensus, I guess, from like the internal medicine people of how they're approaching the most common things you'll look at. So urine cultures is the big one, huge one.
Skin
Skin is
Skin and
another
urine?
one. Skin and urine are probably.
What
Trying
other
to think if
cultures do
there's
we do?
other-
Fluid cold. That doesn't do anything.
I mean, those are just
No, we don't
really
really do
common
that.
problems
No.
that we use
Yeah.
antibiotics on.
Right. Yeah. Yep.
Right?
So
I mean, I'm
trying to think
of
of something else. And I don't think.
we use topical medications,
Right.
but I think
try.
there's less issue with that.
Yes. You try. So I think one thing to think through is like if you have a dog coming in with a hot spot, can you just, to your point, use a topical local medication that's not systemic when you don't necessarily need it to go throughout the entire body? There are the most common antibiotics you're going to use for skin. So or skin is one example. Urine has its own too. So if it's not working the first line when you think it should, you should probably culture it right away, because something obviously is not working to where you don't want to just keep guessing. I think that's how I always explain it to owners is, if I keep guessing, I could do harm to your pet, but also waste your money because you're giving your pet meds that they don't need. There's the wrong one.
Yeah.
I don't know.
No, absolutely. I think that it's, I mean, we try to be good stewards of, antimicrobial use. So, there's really common examples that, because I'm older, of things that we used to do in the past that I definitely don't do now. So, for example, if I have a cat come in that has urinary tract inflammation symptoms, it would be historically, I always just treat them with an antibiotic to just cover them. 97% of them don't have a bacterial infection.
Right.
So, that's a place where, okay, I could probably do better. I can operate in a better fashion such that I don't do that. Or if I'm going to use an antibiotic, I'm going to culture it.
Yep.
So that I know specifically what I need to be using, because the majority of them are going to come back as sterile cystitis. So, that's a really common place. Or like what you're mentioning, skin, really common place that we can be better stewards.
Right.
The problem is there's this rub between the client and ease of treating them, and then also treatment fatigue. So you've got a collie and you have a skin infection, and I'm telling you to shampoo the dog every other day until it's resolved. That is hard.
Yeah.
And so you get into these situations where it's like,
compliance.
How do you get someone to do it? And then they're going to go down the road. They're just going to get an antibiotic potentially down the road, because I don't think there's universal methodology when it comes to how we're being stewards with antibiotics. And so could I then culture their skin? Hey, if you want me to do this, let's culture the dog's skin. Let's make sure that we're using something that's going to actually kill the bacteria versus.
I think it's the degree in which the owner perceives their pet's problem too. Because if they're looking at it like it's just skin, it's a little itchy, whatever, why do I have to spend X amount of money to culture something? Because they're not cheap. Cultures are not cheap in general.
Right.
So a lot of times it's the conversation you have up front of preparing them for it if by certain time or date in recovery it's not resolved. I think my key things too with a urinary culture are, okay, I'm looking at this animal's history. We've been down this road how many times? I have to culture it because there is probably a resistance bug somewhere. And I have a dog who constantly gets UTIs, sometimes not even clinical for it. And it got to the point where I ran out of meds. I ran out of solutions without feeling like I needed to refer. So the other thing I think on that note is trying to tell the owner, okay, this is the first part of information. We culture it, we find the right antibiotic, but then we culture it to make sure it's gone. Because if you don't clear that infection, they don't come back for the recheck, that bug sits there, it creates more resistance to that drug, and then it just perpetuates the problem. So
yeah,
it's a lot. It's hard.
It's a lot. There's and it's you want to stab your eyes out when you're reading this stuff, but then they had those great rounds on antibiotics and antimicrobial resistance, and it was run by a lady that did all four. I think there were 4 different round sections on antimicrobial use, and so she laid it out very well. But it's a lot of information.
It is.
And so, but that's a great resource and she goes through how to read cultures. She goes through how to determine which one of the antibiotics based on sensitivities that you should be using just by doing a little bit of math. And so I think that's huge. It's a good start anyway.
Yep.
Of learning which ones to use and why not to use them and when to use them.
Yes.
And she does a great job of explaining those topics.
Yeah.
So I would definitely refer to that, Katie.
It's a loaded topic.
Yeah.
Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember to send in those questions and leave us a review if you enjoyed this episode or previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thank you.